Patients in the U.S. are being forced to ration life-saving medicine to pay wrongful medical bills.
God knows I stretch the insulin as far as it'll go.
These low-income patients are entitled by law to free care. A nonprofit hospital system designed to help the most vulnerable instead pressured patients to pay bills they should have never been charged.
We were ranked on how many copays we collected in a month.
And many patients who couldn't pay are drowning in debt.
What was this all for? C-section.
At the end of the day, Providence is a corporation.
Why are nonprofit hospitals in the U.S. acting like large businesses, and at what cost?
You do your best every day.
Here's how the richest economy in the world is failing to provide healthcare to those most in need.
This is my window on the world. It's YouTube. I love this view. I would love to just go there for a day trip. You would think that I would maybe have a chance of someday seeing this, but I don't think I ever will. But partly because I don't have the money, and I won't ever have the money to go see them.
Alexandra is retired with disabilities and relies on her monthly Social Security income of under $2,000. She takes more than a dozen pills a day for a handful of illnesses, including diabetes, kidney issues, and bipolar disorder.
This is just all my prescriptions, but I know my cost was probably maybe $300. It's a big chunk of my money, yeah.
Fearing high costs, Alexandra put off going to the hospital until she was taken away in an ambulance for kidney failure in the winter. After being hospitalized for weeks, she says she was charged more than $86,000. Her insurance company negotiated the bill so that she'd have to pay $2,000 out of pocket.
Well, $2,000 is not a light amount for me. So they had me paying $162.50 a month.
But it turned out she qualified for free care, which meant the hospital was never supposed to charge her a bill.
All they gave were 2 payment options. There was no I can't afford to pay. There was no reference to charity care. There was nothing. It was like it didn't exist. And they hid it from me. You know, they literally were not going to acknowledge it.
The hospital Alexandra went to was run by Providence, one of the largest nonprofit hospital chains in the country, founded with a charitable purpose to serve all communities. But over the years, patients say the philanthropic hospital has failed to carry out this mission. In fact, more than half the nation's hospitals are nonprofits that function similarly. In exchange for large tax breaks, the federal government requires all nonprofit hospitals to provide charity care, which means free or discounted care for poor people. 10 states have passed laws that determine who qualifies for charity care. In Washington state, where Providence is based, the government requires free care for those who earn under 3 times the federal poverty level. Alexandra is way below that threshold. A New York Times investigation found Providence was wrongly charging thousands of low-income patients. At the time, the hospital bills affected every aspect of Alexandra's life.
I kept the heat off for a couple months there. Because it was winter, it meant that it was a struggle to pay the bills. It was a struggle to buy my meds. It was a struggle to eat, you know. And I know, looking at me, look, I'm fat. It doesn't look like I have problems getting food to eat, but that's what happens when you put somebody who's diabetic on an all-starch diet, you know, because starch is cheap.
Like all adults over 65, Alexandra has basic government insurance, but is still swamped with charges for care and prescriptions.
I ration out things when I'm getting low on them. God knows I stretch the insulin as far as it'll go. You see, this one is almost empty. I've got 1 dose left in there.
A study found around 1.3 million Americans with diabetes have rationed their insulin in a year.
If making prescription drugs more difficult to get is one of the ways that the system can go about quietly letting people drop dead quicker than they would have otherwise, that's the way it is.
The lack of medical security makes every single day for Alexandra an unpredictable challenge.
I'm scared all the time.
What are you scared of?
I'm scared of homelessness. I'm scared of not being able to get my meds. I'm scared of not being able to afford anything but potatoes for groceries.
So why are medical bills in the U.S. so high? It comes down to this. In the U.S., there are thousands of private insurance companies working with hospitals, physicians, and pharmaceutical companies to decide the price of your drug or medical procedure. That means hospital and drug companies have a lot more leverage to keep prices high as there is plenty of demand. In contrast, central governments of many other wealthy countries set prices for drugs and services to maintain low costs and provide residents with universal health care. In the US, more than 26 million Americans don't have health insurance. One study shows the US consistently ranked last in terms of healthcare access and outcomes among other rich countries, despite spending the most on healthcare costs. Among those same countries, the US had the highest infant mortality rate and lowest life expectancy at age 60. Hattie is among those who don't have health insurance. Because she couldn't afford her hospital bills at Providence, debt collectors are after her today.
That's them calling me on Tuesday. It rang 3 times and then they hung up. I usually ignore my phone when it rings because I've just gotten used to the only people that call me are my husband or debt collectors.
Hattie had a C-section while giving birth when she was 20 years old. With no health insurance, she says the bill racked up to around $15,000.
I don't have that in my bank. I don't have that in my savings. The bills kept coming, and so the amount of money I had to pay a month kept going up.
What was this all for? C-section.
And going through a surgery that I needed to go through because if I did it natural, there's a possibility neither of my kids would have survived. I wasn't going to be able to afford things that I needed, like diapers and groceries. That's when I stopped.
Stop paying?
Yes. I told them I couldn't afford it. And they were like, well, this is your only option. And I was like, well, I can't pay it. And then I went to collections.
Hattie qualified for free care under state law. Providence put tens of thousands of people into debt for bills they should have never been charged. But it's not just Providence. Many nonprofit hospitals have been accused of veering from their missions by putting profits over patients.
Do you ever feel like you'll be free from medical bills and debt?
No? Will anyone? I mean, unless you declare bankruptcy, and even then, student loan never gets wiped off.
Hattie's reality is one shared by so many other Americans. Medical bankruptcy is a leading cause of personal bankruptcy in the U.S. Providence was originally founded by Catholic nuns on a mission to serve people like Hattie and Alexandra. That same mission is still used in its advertising today.
We are steadfast in serving all,
especially those who are poor and vulnerable.
In stark contrast to the stated mission, a New York Times investigation found Providence forced staff to pressure patients to pay regardless of income level.
We were ranked on how many copays we collected in a month. It was written into our language that we could get fired if we didn't collect copays. You feel awful having to walk into somebody's room who's sick and ask them for money.
Did you ever check if they qualified for free care, if they were, low-income patient?
That wasn't part of our plan. This is our team effort and how much we were supposed to get, and our goal every month was $31,000. And then all of our names were on these balloons.
Taylor worked in the hospital's emergency department for 15 years. She once ranked number 1 among her peers in collecting money because she says she feared being punished for unionizing.
Were you able to feel proud ranking number 1 in that system?
Well, I talked the most people out of money. And I knew I had to do it, like I said, because I had to keep my job.
She shared training materials with us that she received at the hospital in 2018. The goal to accelerate revenue.
The training, that was the last training we did before I left in 2021. It's not an option. This one's how to overcome a rejection. The script would be like, hey Anna, I just did your insurance and we ran your insurance and we verified, and it looks like you have a $250 copay. How do you want to take care of that?
What if I said, I can't afford that, I can't pay for that?
Well, can you pay any part of it?
Providence says this specific training is no longer in use, but employees say the culture of prioritizing profit is embedded in the hospital's top-down organization. The CEO of Providence, Rod Hockman, made over $10 million in 1 year and has said publicly nonprofit hospitals do seek to make profit. Even though Providence has reported losses, the organization is by no means facing financial hardship. Providence sits on billions of cash coming from hedge funds, private equity, and venture capital funds.
But at the end of the day, Providence is a corporation. And I don't think a hospital in an organization is designed to actually make people well. It's really designed to be a Band-Aid, and we're going to give you a drug because the drug companies need money as well. And the billing insurance companies need money, and all these people are taking money, but nobody's really getting better.
How is the situation able to continue? Well, healthcare has been difficult to reform partly because of a lack of government regulation and the lobbying power hospitals have. We reached out to Providence for an interview to learn more about its mission. Providence directed us to Dr. Anyaku, who focuses on racial equity and improving access for patients from different backgrounds.
Does the hospital have an obligation to tell a low-income patient that they qualify for charity care?
I don't know what you mean by that. They do. If you have a low-income patient and they've come to seek care and they can't, they get the financial counselor to go through.
I'm asking the question because we talked to some patients who feel like the information for charity care is not readily accessible or it's not told to them up front. So why do you think that is happening?
I would say it's on our website, so it is definitely accessible.
When we went on the website most recently, patients are given guidance to explore financial assistance and get on a payment plan. But patients say they were never informed if they qualified for free care.
What would you say is the topmost priority for Providence?
Health for a better world, serving the poor and vulnerable.
So it's not making more money? Or
Not for a not-profit organization. We're a non-profit organization, so making more money is not our function.
While Providence maintains it's a not-for-profit healthcare provider, the truth for under-resourced communities has been an obligation to pay.
I think there have always been people who are disposable. The fact that I find myself one of them, it's just the way it is. It's the luck of the draw. I was born poor, I grew up poor, I grew up working class, and I've done my best to step outside of that box.
After she spoke to local media about her experience with Providence, Alexandra was reimbursed for her payments, but she's still split between affording her medication and groceries.
I've been eating a lot of ramen. Our rent went up. Things happen,
As a result of an unaffordable healthcare system, millions of Americans like Alexandra live every day in insecurity.
To all the other people out there like me who are mentally ill and struggling, it's hard. You do your best. You do your best every day.